So the other weird thing too with this new meeting is I never know how many people are actually in the waiting room while we're doing this. So, all right. Make sure I'm not missing anything. Okay. Well, good morning, everybody. Kind of a small crew today, but it is the end of school, so somewhat expected, I think. Glad you guys are here. My name is Kelly Carter. I am the program manager for school health services here at the Oklahoma State Department of Education. And with me from the Department of Education is Kimberly. You want to introduce yourself?
Hi, I'm Kimberly Hermosura. Sorry, my camera's off. It's because my laptop's down. But I moved positions over to project manager of behavior, but I'm also assisting Kelly in school-based Medicaid.
Perfect. And Kimberly is also a BCBA, and she's actually going to be moving in, or has moved into that role to be a little bit more supportive for schools on that end. So she's, you guys need anything with behavioral health, she's your girl. All right, now I am going to hand it over to PCG. Oh, before I hand it over, a couple of maintenance things. We would love to see your faces if you're willing to be on camera. Sometimes it's kind of hard to present on Teams whenever you're the only head present. So we'd love to see your faces. But if you have kids coming in and out of your office or in and out of your classroom, then we do recommend that you keep them off because we don't want, this is being recorded and we don't want to see accidentally record kiddos' faces without permission. So that being said, I'm going to hand it over and I'm going to start with, actually I'm going to start with Jenny. I'm going to let you introduce yourself and then you can hand it to the rest of the team.
Muted, Jenny.
You're on mute.
Turn my camera on, but didn't turn my microphone on. Good morning. My name is Jenny Robinson. I work for PCG. I probably know most of you on here. I work on the Medicaid side of things for fee-for-service. If your district's, this is actually not, it is Medicaid and we're talking about MAC today, but I won't be speaking on fee-for-service today. But if your district is interested in billing Medicaid, feel free to reach out. Happy to support you in whatever way I can. I'm going to pass it over to Matt.
Thanks, Jenny. Hi, all. My name's Matt Gillis. I'm just like Jenny from Public Consulting Group, but help support more of the Medicaid administrative claiming side of the program, which is what we'll be going through and talking about today. So if you all participate or plan on participating, you'll pretty much be chatting with me on anything on this Medicaid administrative claiming side of the Oklahoma school-based Medicaid program. And then I can hand it over to John.
Good morning, everybody. My name is John Ward, and I work with Matt on the Medicaid administrative claiming side of the program.
Any other housekeeping items, Kelly? Are we good to jump in with today's presentation?
We're good to go. It's all yours.
So feel free, use the chat. I think they can come off mute, Kelly, but let me know if that's not the case. But ask any questions as we're going through. I'm going to try and keep it relatively high level and go through kind of what this Medicaid administrative claiming, or we'll commonly refer to it as MAC side of the Oklahoma school-based Medicaid program is. So I'll try and keep it zoomed out, but if you all have any very specific questions or have heard stuff from other districts that already participate, feel free to throw them in the chat. We'll be monitoring it. Happy to stop and answer anything you all have. So just starting off, Jenny talked about fee-for-service billing, and you all, if you're going to participate in the Medicaid administrative claiming side, also will be billing for these services through fee-for-service, but Medicaid administrative claiming doesn't require that one-to-one billing to get reimbursed, just like the fee-for-service side does. What we do instead on the Medicaid administrative claiming side is we utilize the random moment time study, or RMTS. And this is how, instead of needing all your providers to submit additional documentation for the MAC side, you also get reimbursed for administrative individuals on the MAC side. So instead of making them document everything they're doing, what we utilize across the state is the random moment time study. And what this is we have currently 2 periods set up in the state of Oklahoma, a August through December semester, and then a January through June semester. So from the first day of school for your district to the last day of school for the semester, if you're participating, you'll give us a staff pool list, and then we, PCG, will randomize everything across the state, and then we'll send out questionnaires spread out completely across the semester. And what these questionnaires are is they're basically 4 quick questions, just asking if they're working at the time of the moment, if they're working with a student, and that's a yes or no questions. We don't need, someone to say, yes, I'm working with John Ward and give us student information. It's more just to see what they're doing. And then we ask a couple more specific questions about, were you helping with an IEP, or were you providing a direct service, or were you just doing administrative work? So it's a 4-question questionnaire that gets spread out across the entire state and across the entire semester to figure out what people are doing throughout the semester. And then we, PCG, will take all those results from statewide and then apply that to figure out what amount of time is reimbursable on this administrative side. So PCG handles the brunt of figuring out the calculation on those percentages, sending out notification emails to participants. So this random moment time study is hopefully here to not be a huge burden. And again, it's spread across the entire state. So the more districts that sign up to participate, the less questionnaires that can theoretically go to each person, because there's a set number that we set out for the entire state. So that's the random moment time study. And that's really how we get the data that we need to figure out reimbursement and what y'all will get reimbursed for your participation each quarter if you do choose to participate. And like I said, we've changed this from the past. So if you have heard us talk about the random moment time study in the past, or maybe participated a while ago and then stopped, we've kind of changed up this process. So we used to have to do it quarterly. We had a lot more questionnaires that had to go out every single quarter. But with new CMS changes that we implemented within the past year, we now are semester based. So there's no time study when your staff aren't in session. So from July through whatever your first day is in August, we don't send out any questionnaires. We don't bug you for anything on the random moment time study side. And then those questionnaires are set to start whatever your first day is. We see from collecting calendars, that's typically early August, and then we go all the way until December 31st. We know you all have Christmas break that usually starts hopefully the week before Christmas, somewhere around the 20th, somewhere in there. While you all are on break, we won't send questionnaires either. And then we start up again January 1st, technically, but hopefully no one has school on January 1st, and then go through June 30th. But it's the same way whenever your staff are done coming in for the regular school year is when you all will stop getting questionnaires. And we get all that info through our PCG claiming system. So everything on the Medicaid administrative claiming side of the program is all done through one claiming system, all one website, so you don't have to go to multiple spots to manage all this. So hopefully easy for y'all as potential individuals to participate. We've heard from coordinators that do participate that it's very easy to get into the system and get stuff going. But in order to participate, we'll need a couple things. So the first is, if you're going to start participating in an August, December time period or semester, then what we'll need to find out from you is your first day of school for staff for that semester, just so we know, okay, this Oklahoma school district is starting on August 2nd. We, PCG, get that built in for you, so we know questionnaires for your district will start on August 2nd. And if you don't start until August 4th, we get that built in too. So that's the first thing we'll need from you all, is your first day of school for the staff for the semester. And then the second thing is a staff pool list. And I'll go through on the next slide of what the staff pool list is made up of, but we'll do a staff pool list every semester. This is to get an updated list of staff members. So you'll complete a staff pool list in like this May, June time period to start for that August, December semester. And then we'll do one in about November to get everything set up for January through June to start. So the biggest administrative lift, honestly, for this Medicaid administrative claiming side of the program is the first semester that you choose to participate, just because you have to create that staff pool list from scratch. After that, we roll over the staff pool list every single semester for you. So you only have to make small changes and updates and that type of thing. Whereas as it keeps going, there'll be less and less for you to have to do staff pool list side. And this is like the rough timeline. It's a very cyclical program. So you'll always know what's going on in the Mac side of the program, when stuff will need to be worked on. And now that it's semester based, there's only 2 staff pool lists that you have to then create and update, and then 3 financial reporting periods. So every period or semester that your district participates in the time study is a period that you get to report financials for those staff members, and then you get reimbursed on the expenditures that you paid for their staff pool list members for the semester. So August through December, you'll participate in the time study, you'll create that staff list, and then you'll report financials that you paid for those individuals from August 1st through December 31st. And then you'll report that to PCG through our claiming system. We will handle figuring out the claiming amount and how much you're owed in reimbursement, get everything then calculated and filed with the state, and then funds will then be distributed to you based on that. Same process for January 1st through June 30th. And then also that summer time period from July through August, we know you may have retirement payouts or 12 or 9-month employees who are paid out on a 12-month schedule. Those types of financials, you also don't miss out on that because we have a July through August financial reporting too, just so you can get all the reimbursement possible by not missing out on reporting any financials. So there's a lot of months and stuff in here. It's very cyclical in nature. We do our best to keep you updated with knowing kind of what's going on, what you should be working on at each time of the year. But this slide here is kind of that zoomed out view of knowing May we'll be working on staff pull lists, June we'll be finalizing that, October we'll be doing another staff pull list, November we'll be finalizing that. So those are really the kind of the months where this will kind of peak up. You'll take a look at it, make updates, and then go from there. I'm going to pause quick and just see if there's any questions at all, kind of what I've went through already on the time study itself, or just rough timelines for this program.
There aren't any questions in the chat yet, but people do have the option to come off mic if they would like to ask questions. So
yeah, so definitely feel free, stop me if there's anything. So you don't have to keep listening to me just talk, happy to hear, but just continuing on, like I said, we'll need those 2 key things if your district wants to start participating. And again, you can start participating at any time. If you want to start participating in the first semester of the school year, you'll reach out to us pretty soon within the next week or so we can get that first day of school from you and then get you added into the system so you can start working on your staff pool list. If not, if that feels too soon for you, then you can definitely reach out, let us know you're interested. We can work to get you added in, and then you can always start participating in the January through June semester. So whatever works best for your district, we will definitely work with you to make sure that that is possible and is there for you to be adaptive to that. And if whenever you decide to participate, the real things that you'll have to do to start is, like I said, that staff pool list from scratch, which I'll go through. Very easy. It's more just kind of figuring out the connections you need to make with whoever your HR is. So you can kind of know all the FTE staff you have that you can then put on your staff pull list. And then that calendar, so within the claiming system, we'll ask for what your staff days off are so that you kind of can put that into the claiming system, because we don't want to be sending out questionnaires on any days that your staff members aren't going to be in, aren't going to be working, you have as holidays, those types of things. And then once that semester comes to an end, we have a training for each thing. So we have a training related to staff pull lists and calendars. We also host a new coordinator version of those trainings. So it's only districts that are brand new, so can ask more questions. We go into more depth, but we do that for the staff pull lists. And then the same thing with financials. So Once the semester comes to an end, financial reporting opens. We give you all a little over a month to kind of get those financials together and reported, but we also have financial trainings to the whole state, and then specifically guided new coordinator and new district sessions for financials as well. So this isn't the only time if you choose to participate, you'll see any of this, but these 3 steps are really the 3 things that will keep flowing through, like I showed on that other calendar page, but this is a little more simplistic of update your staff pull list, make sure your calendar's up to date. You'll go through the time study and then report financials. And those are really the 3 key things that you have to do to participate in this MAC program. And it kind of just keeps rolling. So that's one of the big benefits about the MAC program is once you get it up and running, it really kind of just keeps rolling. And then Kelly, we got a question on the recording and the PowerPoint for this session. Is that going to be sent out or posted somewhere after?
Yes, I typically will send out the recording, hopefully by the end of today, if not by tomorrow. And then I have a live binder that I put all of our recordings in a YouTube channel, so they're always sitting out there for anybody else who would like to utilize them. And then if you give me the PowerPoint, I can send it out.
Yeah, definitely. All right, perfect. Thank you, Kelly. All right, so just continuing on, what we now actually have is a claiming system demonstration. So we have a training version of the claiming system where all things for this program will go through. So like I said, everything MAC is going to go through this one website. This is where you will create your staff pool lists, you'll update your calendars, you'll report financials. So everything is going to be done through this system that I'm in right now. This is where we have all sorts of resources. So like Kelly said, she will send out PowerPoints and trainings. We also PCG for those trainings that we host. We record, we put those trainings up. So there's all sorts of resources for you outside of those that Kelly will post for you that PCG also posts and has up there. So this is what this claiming system looks like. You'll see here that I'm already logged into a demo district. We'll try and keep these resources and this homepage up to date. So like I said, we'll send emails out to you. So if we know you're a coordinator that does the staff pull list side of things, we'll let you know when those are updated or open for you to make changes via email, but then also put like due dates up here of it's time to start working on the staff pull list, or these financials are open. Here's the training recording. Let us know if you have questions. So that's going to be all found here. But once you're ready to participate, you'll just go in and navigate to your staff pool list. So we already have a couple positions in here. There's going to be 2 different types of cost pools that we'll put these individuals into. We can put any direct service individuals into this program, and then also administrative staff. And that's because we know direct service individuals, even though they are direct service, they're providing services to students, any time that they have to take to sit and update goals in an IEP, or maybe sit in with a meeting with parents to help them understand the services that are being provided to students. Those are all administrative that you're not going to get reimbursed for on the fee-for-service side, but are getting reimbursed for if you participate on this Medicaid administrative claiming side. So everything with Medicaid administrative claiming are tasks that your staff members are already doing, whether they're direct service or they are administrative individuals. So we know, like I said, direct service members, updating goals and IEPs, sitting in with parent meetings. You could have administrators that sit in on those parent meetings or help with those kind of facilitating. If you have someone who's like in charge of outreach for enrolling in Medicaid or understanding their students that direct services they're getting, and that's an administrative role you have. That's why we allow for 2 different types or groups of individuals, those administrative and then those direct service. And you get reimbursed for both the same exact way. So we figure out how much time throughout the state was spent by direct service individuals doing those administrative activities. So updating goals and IEPs, coordinating to make sure services were provided. If you have to take the time to set up transportation, your student has to go to a facility outside of your school to get the services that they need and then come back. Those kind of efforts to sit there and coordinate that are all that's reimbursed through this program. And then to add a new person, you'll just go add new job position. That cost pool is, like I said, just so you can kind of know, are they a direct service individual? Are they administrative individual? And then the job category, these are created and updated. So PCG worked with OSDE and OHCA to kind of get every provider that you all can currently bill for and may have in your schools, and then the names of those. So the direct service is going to match up pretty much one-to-one with those positions that you're accustomed to seeing for your direct service providers. The administrative side is a little more flexible, so we tried to put some more broad. So if maybe you have an interpreter, but you don't call them interpreters, you call them language assistant specialists or something like that. On this administrative side, it's more the best of your ability to kind of match up because it's not tied to billing. Those job categories or job titles don't have to be one-to-one, whereas with the direct service cost pool, they will be a little more one-to-one. We also ask you for shifts. You'll see there's quite a few here. That's just because this is for the training site and we add in a couple. But really what we look for in shift from you is just to figure out the earliest start time and the latest end time for these job categories. So I know interpreters at our schools are in from Monday through Friday, 8 to 1. That then tells PCG, don't reach out to this individual outside of 8 a.m. to 1 p.m. because they won't answer the questionnaire. And that's totally fine. That's exactly what we are looking for and all we're looking for a shift. Then we need an email for that participant or staff list individual. That's because all these questionnaires just get sent out via email. So we will reach out to Josie here, who is an interpreter at our district. PCG will reach out if she gets one of those questionnaires or random moment time study moments at the date and time that she gets it. So if she were to have a questionnaire she needed to fill out on May 13th at 9:23, she would get an email from PCG right now saying, hey, Josie, your district's participating in this program. It's important that you go fill out this questionnaire within the next 2 days. Here's the link. And all Josie has to do is click the link and it takes her to the questionnaire page. They don't need a login for the questionnaires. It's all through the PCG claiming system. So it's all then kind of through our system, but they don't need a login because the only thing they're accessing is that questionnaire, and they only access that questionnaire through the link. So that's why we get their email, and then obviously first name, last name. You'll create that job position, and then you're done. So you'll go through this process. Like I said, it's the most intensive the very first semester that you participate, just because you'll need to add all these people for the first time. But after you participate for multiple semesters, like I said, this just keeps rolling over. So if you know Rose left, you can go and update this and remove Rose and add someone new who is that physical therapist for your district. So once you have all that added in, your staff pool list is done. You'll certify that. The other thing that we need to just start and kick off with the program is also a calendar. And like I said, this will just tell us what are the days that your staff pool list members are supposed to be working. So we are still off for the first week of January, just because I'm in the second semester here. So you just click the calendar with those days off and then save changes, and then your calendar is up to date. So whatever you need to do to put in here, we have a last day of school button. So if your last day of school is May 28th, you'll click that and save changes, and it'll block out the rest of your calendar. And all these red days do is tell us, don't reach out to our district because this is a day that everyone has off. And that's all we really need from y'all, is that staff pool list updated and then these days off for the semester. And you'll do that twice a year. So your staff pool list and your calendar are only done twice a year. and then you'll go through the program. Those questionnaires, again, will be sent out by PCG. If your district participates and you're a coordinator, you don't have to worry about sending those emails out. PCG handles all the notifications of giving those individuals a heads up, letting them know, hey, it's actually time to complete your questionnaire, giving an update, a day after. They have 2 days to respond or complete that questionnaire, and that's 2 working days. So if they get a questionnaire on a Friday, they don't have to go and answer it Saturday or Sunday. The due date won't be until Tuesday because we'll give them 2 working days. And if you happen to be off on Monday the 10th, then they would have until the 12th. So that's the other thing this calendar takes into effect is we don't want anyone having to feel like they have to work outside of their normal working hours or on weekends. And this program and our system takes all that into account too. So that's nothing else you all have to worry about either. So we'll notify everyone. PCG will take care of those things. We just may rely on you as coordinators to say, okay, it looks like John isn't doing his questionnaires. Maybe he just doesn't know to trust emails from PCG. So we'll tap Jenny and say, hey, can you reach out to John since you're the coordinator for John, and just let him know to go take a look at that PCG email, take care of it. It's okay to click on those types of things. So that's where your role as a coordinator, whoever kind of looks after this MAC side of the program, will come into play. Any time study questions here? I'll pause here again. Anything that I kind of went through a little too quick on the staff pool list side, the calendar side, questions on those days off, anything I can help you all with kind of on this questionnaire or time study side of the program? I'm not seeing anything in the chat, not seeing anyone cut off mute, which is totally fine. So feel free. We will have contact information after the session. So if you're interested, you can reach out to us. If you have questions, you can reach out to us. What I am flipping through here is the financial side of the program. So what your district after the time study will do is you will go in to our claiming system and we will take that entire staff pool list that you provided for us, and then we will transfer all that over to this financial side of the program. And then for reimbursement for the Medicaid administrative claiming side, all you have to do is report whatever expenditures your district paid from the first day of the quarter to the last day of the quarter to that individual. So you'll see Misty here is a demo person we have set up. Their salary for the quarter, they were paid $10,000 in wages for their role as a school counselor. They got $2,400 in benefits. That's all you have to report in. So grabbing your financial ledgers, we will transfer over this staff pool list to the financial page. And then anyone that participates in the time study, whether they get a questionnaire or not, you can report financials for the semester. So even if Ashley didn't happen to get a questionnaire because they're totally randomized, that's okay. You still get to report financials for them as a district because we take statewide results to figure out reimbursement. So that's another thing to note is we will send out 1,500 questionnaires across the entire state each semester. So we have a couple hundred providers already on the staff pool lists. And then that's spread out now over 6 months per semester. So we kind of break that out to really participants shouldn't be getting too many questionnaires. They may get a couple within the same month. They may get one per month. They may get 0 throughout a semester. It's 100% randomized how these questionnaires go out, but that doesn't affect your district's reimbursement at all because we take statewide percentages. So if you only got one questionnaire or if you got 15 throughout the semester, reimbursement is exactly the same. And then that applies then to financials for individuals. Is it doesn't matter if they answered a questionnaire, it doesn't matter if they had a questionnaire or a moment that they missed, just so long as they're on the staff pool list, that you can then report financials for them and PCG will calculate the reimbursement for them and then how that flows through to your district. So that is all I really have presentation wise. So that's the staff pool list and the calendar, which is the random moment time study portion, and then the financials. So that's how everything really flows through from the beginning of when you choose to participate in this program through getting set up and then getting reimbursed for this program. So we kind of do that all, help you all with that. The claiming system also, just while I'm looking at it here, helps you monitor those moments. You can see if you have any outstanding, those types of things. So the claiming system really is here to make everything as easy as possible for you, so you can kind of know who you have to reach out to, what's outstanding, whether it's questionnaires, whether it's financials, whether it's a time study or a staff pool list piece. So really we try and keep everything very streamlined for y'all, so you don't have too much to worry about on this Medicaid administrative claiming side of the program, because like I said, it will flow through. Once you get it set up the first time, it will kind of keep rolling and keep flowing. And that's the other, good thing about this Medicaid administrative claiming side of the program is these funds are unrestricted federal funds that you get reimbursed for this program. So that means that you can then put them back to paying for a service provider salary, or you put them towards other things necessary for your school to keep providing services. But once you get those financials back or the reimbursement back, if you put it towards John, who's on your staff pool list, you don't then have to report those financials as federal again. You can just keep rolling financials, keep using the reimbursement from this side of the program to offset other people's salaries, maybe hire on new staff members you need, are all things we've kind of seen with districts that are already participating in the program. Is the reimbursement comes in, can be applied, and then kind of just keeps flowing in that way. But like I said, feel free. Our emails are all here, phone numbers to give us a call. If you have any questions at all, after the session, you send the recording to someone else or the PowerPoint to someone else who may want to take a look and have questions. Definitely feel free to reach out. We are more than happy to help with anything, any questions you may have, but anything that I can go into more detail on that you all have questions on, anything I went over a little too lightly that you want more detail on. Like I said, use the chat if that you're more comfortable with that. You can come off mute, but anything I can answer right now for all of you on this Medicaid administrative claiming side of the program. All right, I am not seeing any questions in the chat or people coming off mute. So I think we are all good with today's sessions. Like Kelly said, she has all sorts of places that the recording for this session will go out to. And then same thing with the PowerPoint. We'll make sure Kelly has this to send out, but feel free to reach out if you have any questions. But Jenny, I don't know if there's anything else, just since I saw you come off mute.
Yeah, no, that's great. I think people are leaving the chat, so it doesn't look like people have questions. And since they have your email address to get a hold, and most of them have mine, I think we are good to drop off.
Perfect.
Thanks,
Well, thanks
Matt.
all for coming. Yeah, everyone has a great rest of your day and a great rest of your week.
Yeah, you too. Bye-bye.